associate dentist needed in Oregon. Did I say it right, Brian? I don't want to mess it up the first off the bat. How do I say Oregon?
Yeah, Oregon. Yeah, it's not a shave, not Oregon.
Okay, good. I did it. I have life there. So I'm here with the awesome Dr. Brian Summers on Dentist Job Connect TV, and we're looking for an associate dentist who wants to work in this awesome practice, which has some really awesome, unique toppings to it. So, Dr. Brian, I say there's 5 questions that need to be asked and answered for every associate. So, one, let's go with where is this position?
Yeah, so we're located in Albany, Oregon. It's kind of known as the hub of the Willamette Valley. So if anybody's familiar with Eugene, home of the Oregon Ducks, go Ducks.
Nice.
Just a little bit north of there, probably about an hour and change south of Portland. So kind of the heart of Willamette Valley. If you head east an hour, you're in the mountains. You head west, you're on the coast. So lots of access to fun outdoor activities. There's lots of mountain biking nearby here.
Nice.
Fishing, all sorts of good stuff.
I was there for a NASDAQ conference. I'm coming back this year. I really had a good time in Oregon. So now I'd say, what's your why, right? Everybody has a why, popular thing from Simon Sinek. So you are a dentist and you need an associate. Why do you need this associate?
Yeah, so kind of 2 reasons. The first one is my current associate who used to own the practice and now he's my associate. He's getting to retirement age and he's looking to slow down. And the other main reason, so we have a very unique dental practice. So half of it is a regular dental practice where you see typically developing folks here in our clinic. And then the other half is hospital-based. Okay. So we see lots of folks with special needs, intellectual developmental disabilities, medically complex. And that part of our business has really grown a lot in the last 3 to 4 years. We're one of the only providers of hospital dentistry in the state. In fact, we have the largest,
that's awesome.
Largest practice for hospital dentistry in the state. And maybe, I haven't looked at statistics, but maybe even the Northwest. So people come from 4, 5, 6 hours away to see us and get their dental work done. And because of our reputation and just being one of the only providers now in the state, our referrals have just exploded without any advertising.
Very, very cool. I think it's amazing. You should be proud of yourself for helping a patient population that I'm sure it's not easy to find people to help them. And that's really, really awesome. And I did a hospital-based residency program in 2002 to 2005. And I just think it's really just a amazingly awesome part of dentistry. And I think that, as we move forward in this interview, I'm getting you to the next question. Would it be valuable for the associate to have experience as a GPR resident, or is this something you could train there? Or tell us a little more about that.
Yeah, so our hospitals that we work out of, it's one system, but we work out of a couple of different hospitals. They actually require a hospital-based residency.
Gotcha.
And so that doesn't necessarily mean a GPR. I did an AEGD that had an OR component. So I did some work in the OR. So it doesn't have to be a GPR, but it does. Someone has to have had hospital credentials at their residency.
Oh, cool. So we got the where, we got the why. Now, for your associate that's going to be working, tell me about the what. What procedures are they going to be doing throughout the week?
Yeah, so we do a lot of, the routine bread and butter stuff, crowns, bridges, fillings, some extractions, some root canals. We have stuff for implant placement. I place implants, the more straightforward ones. The oral surgeon's office in town is literally right across the parking lot for us. And that was by design. The previous owner, my associate right now, owned the properties here and next door and purposely put them in next door so he could start doing all-in-4 cases. So we do quite a few of those. I also am certified in IV sedation. So we have all the equipment to do IV sedation in office.
So we do some fundamental things. You know what, Brian, I'm trying to make a movement. When did you graduate from dental school?
I graduated, so I took a little bit of a detour from undergrad to grad school, but I graduated from dental school in 2012.
Nice. I was 2002. And can we stop calling it bread and butter dentistry? You want to know why? Nobody eats bread and butter. Do you go back to your home and there's a giant loaf of bread and butter on the table? So I want to start calling it kale and quinoa dentistry, but I'm just making a joke in that people are doing the fundamental bread and butter, kale and quinoa procedures with also an awesome opportunity to learn more advanced things from you. And it sounds like the dentist that you work with. So I love that there. Now, I don't know if you're dental school, it's getting more and more expensive each year. Okay. They have, how much can they charge? Question infinity. They can charge infinity. So let's say I'm a dentist. I did a hospital-based residency. I want to come out there and work with you. And it's like, hey, how am I going to be compensated? What is that compensation going to look like? It could give me good, better, best from a, guarantee to what you could do. Tell me about the compensation.
Yeah. So there is a minimum daily payment or a reimbursement to start. So there's kind of a fallback net if things aren't busy enough. But really, I mean, it kind of sky's the limit. As much as someone's feeling confident in their speed and their procedures and techniques, I would estimate they could do anything from 180,000 up to, I would assume, 300,000.
Awesome. Great range there.
Yeah, I mean, their schedule should be pretty darn full. I don't anticipate a lot of lags.
I'm someone who's acquired multiple practices. I've worked with 65-year-old dentists, many of them. And my sense is when your associate comes on, as your 65-year-old starts to decide to hang up the handpiece, they'll probably be able to shift some cases to the associate dentist. Cause I've seen that happen. The older dentist is like, oh, suddenly I don't have to do everything. And there's probably a good opportunity to grow that way.
Yeah, and the plan is for him to almost completely step out once another associate comes on board. He'll work on some of the all-on-4 cases and more complex implant cases for another year or so.
Awesome. Well, you've done a great job with the top 4 questions. The 5th question really has nothing to do with crown preps or occlusion or memorizing the Krebs cycle. I want to share, I'm talking with the awesome Dr. Brian Summers. You can text Albany to 215-798-9897. You can go to dentistjobconnect.com to see this awesome position in Oregon. But what fun things are there to do outside the operatory, right? Dentists are people too. They don't always think of us as people, Brian. Not easy, our life. But let's say I'm a dentist, I work with you, we finish at 5:30, 6:30, whatever, and I say, I'm going to go do something fun. Reinforce, what are some of the fun things to do in the area outside the operatory?
Yeah, so I mean, like I said, there's lots of outdoor activities. So if you're a mountain biker, there's so many mountain biking trails nearby. Get to them within 15 minutes. Great place to run. Oregon is, Nike town in Eugene.
Oh, yeah.
It's where Nike originated. So lots of running here. As far as if you want to extend to weekend activities, several different ski resorts nearby. So lots of snow, lots of opportunity for skiing, snowboarding, fun things like that. We have several different great lakes and rivers around here for fishing if people like doing outdoor activities. And then there's the coast. So we have one of the most beautiful coastlines in the country. So spending time there, again, fishing is another big activity there, but people can travel a little bit north and do like kiteboard sailing or whatever. I can't remember what it's called. Yeah, there's lots of different fun things to do here.
Awesome. Well, it sounds like you've done an amazing job explaining the awesomeness of this position for an associate. I appreciate you sharing. You guys, you've hit on the mentorship available, the money dentists can make, and the morale. And I actually, want to just reinforce, I think it's really cool that you treat a whole segment of the population that people can feel really good about helping and do something different than just standard everyday dentistry, but also do some of that too. So thank you so much for sharing with us, Dr. Brian. Go to this position on dentistjobconnect.com or text Albany to 215-798-9897. Thanks so much.